Welcome to WebMD's Ask the Pharmacist. We're going to answer some of the most common questions about medications, prescription, and over-the-counter with our expert, Makary Marciniak, Clinical Associate Professor with the UNC Eshelman School of Pharmacy. Today we're talking about vitamins and supplements. Let's get started. How many hours should I wait between taking calcium supplements?
So most people taking calcium over the counter will need between 1,000 and 1,500 milligrams a day. And for most products available over the counter, that means between 2 or 3 doses during a day. The most common form of calcium available over the counter is calcium carbonate, and that is best absorbed when taken with food. So I most often recommend that my patients take their calcium with breakfast, lunch, and dinner. In this way, they're taking the product with food, so it'll be better absorbed, and it'll help them to remember to time it with the meals. So breakfast, lunch, and dinner. There's not a specific amount of time that you need to wait in between taking doses, but probably you want to wait at least 2 to 3 hours between your doses.
But you want to take 3 doses?
Yes.
Okay. Is it good for men to take an iron supplement?
Great question. Iron is a very essential element that everyone needs in their body. Now, most men probably have enough iron and don't need to take an extra in the form of supplements. But if they did find that their iron was low and they did have their doctor recommend them for them to take a supplement, that would be smart to do. And probably the most common form of iron I see over the counter is ferrous sulfate. And they would probably need to take 2 or 3 pills a day to get their iron supplements back up to speed. You may also see some iron supplements marketed as being gentler or easier on the stomach, and those products can be okay to take as well. So most men may not need to take a supplement, but if their doctor recommended it because their irons were low, then it would be a good idea to supplement with over-the-counter products.
Our community also wants to know if there's any such thing as a protein pill or if all protein supplements are in drink form. Good question.
Yeah, I see a lot of people looking to take protein supplements these days. And I'm not familiar with one that comes in a pill format, but certainly there may be some out there. I think the more common supplements we see are protein powders that can be mixed to make a drink, or a lot of protein that's added and fortified into shakes and other products available over the counter.
I currently have MS. From what I have just read, vitamin D is good. How much is recommended or safe for me to take as a supplement? And thank you for your help on this.
So vitamin D is a very popular over-the-counter product, and it's good for people of all medical conditions or health. So it's good potentially for people with multiple sclerosis, but also good for people's general health. So the probably most common dose is about 800 to 1,000 international units a day. So I would probably recommend somewhere within this range for the patient, maybe between 800 to 1,000 international units. And probably you'll find that in one pill alone that you can take over the counter.
Okay, and your pharmacist can help you measure that?
Absolutely.
Terrific. Where is the best place to purchase cod liver oil with DHA in it that is reliable? I read in a newspaper article that some cod liver oil supplements really do not have what they claim to have in it since it was not evaluated by the FDA. Good question.
Terrific question. You can tell that we have a very savvy consumer here.
Definitely.
So it is very important to know that all supplements that are available over the counter, dietary supplements and herbal products, are not approved by the FDA. So there can be a lot of products out there that companies have just put out onto the market. And the best way to check to make sure you're using a reliable product is to use a symbol called the USP verified symbol. So USP stands for the United States Pharmacopoeia, and it's an organization that independently tests products for their quality. And so if you see the USP verified symbol on a product, you know that it has the ingredients it says it has in the right amounts and doesn't have anything else that's unsafe. So if you're looking to purchase any product, whether it's cod liver oil or any other supplement, I would look for one that has the USP verified symbol on it.
I've been searching the web, and from what I've read, I can take up to 2,000 international units of vitamin D and be safe, and also take 1,500 milligrams of calcium daily. Is this safe?
Calcium and vitamin D are probably the over-the-counter products I get asked the most about. So the recommended amount of calcium is probably anywhere between 1,000 to 1,500 milligrams a day, depending on your age, and vitamin D probably more between the ranges of 800 to 1,000 international units a day. So I probably wouldn't recommend as much vitamin D as 2,000 international units if somebody was just taking it for their general health. Now, if somebody has had their vitamin D level checked and it's low, then I think recommending up to 2,000 international units a day over the counter could be helpful. But I'd say if somebody was using this for their general health, I'd go for a range more of 1,000 to 1,500 milligrams of calcium or 800 to 1,000 international units of vitamin D.
What can happen if you take too much vitamin?
Great question. So vitamin D is one of the fat-soluble vitamins, and if you take too much, it can stick around in your body. So we want to make sure that you use a safe amount, but not something that's too much. So I think 2,000 international units is a little bit on the higher end, and I wouldn't use that amount unless somebody had been checked to see that their levels were low.
Is it okay to take vitamins with milk, or should it be water?
You can take vitamins with whatever beverage you choose. So milk could be appropriate, or maybe water or juice, whatever you can use to help that medication go down a little smoother.
Can you take too much vitamin C? My husband is currently taking 3,000 milligrams a day. Is that too much?
So vitamin C is a water-soluble vitamin. And generally, if you take a little bit more than you need, your body can get rid of that. But even for the water-soluble vitamins, we have maximum amounts that we'd like to look for. So I'd say that 3,000 milligrams is a little too much vitamin C. Okay. I think if somebody takes that much vitamin C, especially every day, they might see some more side effects, maybe an upset stomach or diarrhea. And maybe for somebody who's prone to kidney stones, it could increase their risk. So I think that's just a little high, and I'd recommend lowering that dose.
Okay. And would the dosage be different for a large person versus a smaller person?
Oh, good question. For vitamin C, the dosing does not matter depending on your size. So it's pretty much a standard dose across all age ranges or sizes.
Can I take black cohosh if I'm on Synthroid?
Good question. So black cohosh is an over-the-counter product, a dietary supplement that's often used to treat symptoms associated with menopause. And Synthroid is a prescription medication used for thyroid conditions. And it is okay to take both of these products together. There are no interactions. However, if somebody was taking Synthroid, I'd remind them that they should be taking that on an empty stomach about an hour before they have other food. But they can take both the Synthroid and the black cohosh together.
I am taking a calcium supplement. The front of the container states calcium 600 plus vitamin D, but on the back it states serving size 2 tablets, and each serving gives 1,200 milligrams as calcium carbonate. I'm confused about how much calcium and vitamin D each tablet contains.
Again, somebody who's reading their labels, this is phenomenal. So let's break this all down. So typically on the front of the container, it will state a milligram amount, so 600 milligrams in this case. That's referring to the amount of elemental calcium that's in the tablet. But it is so important to read the back of a container. Underneath a section called Supplement Facts, there's key things that everybody should be looking for. And this very savvy consumer points out one of them, the serving size. It's important to take a look at serving size to see how many tablets you might need to take to get the required amount. So in this case, it's 2 tablets to give you your full amount. Now, it also mentions calcium carbonate. That's the specific type of calcium that's available in this product. So in general, this product contains 600 milligrams of elemental calcium. And it's best if this person takes 2 tablets to get that full amount of elemental calcium. So I think it's very important that consumers read a label fully before they take any product. Look at the front, but also read that back. And be sure you know the contents that are included in that product and how many tablets might be part of a serving. And if you have any questions, ask your pharmacist. They can help you read that label and understand to make sure you're using things appropriately.
Well, Macari, that's going to do it for us today. Thank you. And thank you for continuing to count on WebMD as your source for health information.